For the program year 2021 checklist open forum, this presentation is provided through a shared commitment between Access, Health Current, and Myers and Stofers to increase participation in the Medicaid Promoting Interoperability PI program. A few logistical reminders for today. Today's open forum will be recorded and posted to the Health Current and Access websites. We encourage you to use the chat box for questions or comments, and you may also use the raise your hand feature, and we would be happy to take you off mute if you would like to ask your question live. Please include your name, practice organization, if you put comments in the chat box, and do not include any confidential information such as patient health information or PHI. Again, we are going to mute all lines for the start of the presentation. Connie, are you with us?
I'm here, Christine. Thank you. I have the honor of introducing our presenter for today, Priscilla Clark, who is a senior accountant for Myers and Stouffer, a certified public accounting firm that specializes in federal and state Medicare and Medicaid programs, is our webinar presenter for today. Priscilla has a great deal of information and has a lot of experience, so we're very blessed to have her today. So Priscilla, are you ready to present?
Yes, I am. Thank you so much, Connie and Christine. So today's webinar has already previously been mentioned. It is going to be an open webinar, so if you do have any questions throughout this presentation, as I just show you all the resources that are available to you because of Health Current and Access working together, feel free to put a comment in there with any questions you have. You can also request to be unmuted to ask any questions that you may have, as well as you can raise your hand on the WebEx settings so that we know to unmute you. So either of those options work, and we'll try to answer your questions as quickly as possible. So you should all be able to see my screen, and what we're doing is we're showing the Access checklist for program year 2021 for stage 3. And so this checklist is out there and available for you. Access should be posting it to their website within the next week. And it kind of just walks you through the steps of the information that's eventually going to be collected in EPIP when you go into the system to attest for program year 2021. So on the front is just some information, some instructions on how to use this tip sheet. As you can see, there's two different links on this first tab. The first link, which is on row 5, is going to be it's the Access website, which has a lot of presentations out there and available for you to use. And so in a few minutes after we're done walking through this checklist, I'll take you to the website and just kind of show you around and how to use it and what type of information is out there for you to use. And then also there is just the normal EPIP system. This is the link that takes you to the system for you to register for your providers. So we'll go to the second tab, which is the general information. And so this is information that you can enter in now on behalf of your providers. And so program year 2021 attestations have not opened up yet. They will be opening up during the second quarter of this year. And so if you want to get a step ahead of everything and just make sure you have everything organized, you can go ahead and start entering in this information. As you can see, there's different sections on this general information tab. And so right here in the section for general information, you're going to enter in certain things that EPIP's eventually going to ask you. So in these blue boxes is what you would fill in. And so you would enter in the provider name, their APN number, their NPI. You would do their payment year number. So, and this is a drop down. So some of these cells, they'll have drop down. Some will have where you fill it in yourself and write in what information goes there. And so for this drop down, you would pick, okay, I am in year 4 payments. Okay, and we'll put this provider as John Smith. I'm going to zoom in some, and I'll zoom back out so you can see the whole Excel spreadsheet when we're done with it. And so right here for stage 3, or stage of meaningful use, all of you should be in stage 3. So if you go in and put modified stage 2, you can see that this red right here to the right-hand side, this popped up. And it says EPs must have fully upgraded to a 2015 edition cert to attest for program year 2021. And so it's kind of telling you, hey, you're not supposed to be in modified stage 2, you need to be in stage 3. And that's where we put the drop down for stage 3, and that red sentence went away. You would also enter in the cert edition year number. So is it a 2015 edition the entire time during the meaningful use reporting period, or is there a combination? If there's a combination, you select that. It's going to tell you the requirements for this year and that the EPs must have fully upgraded to a 2015 edition cert. Okay. The next thing is you're going to enter in your EHR certification number. You're going to put in the implementation date. You're going to put in your security risk analysis completion date. And as you're filling in this information, there's a lot of helpful tools that are throughout this Excel spreadsheet. You can see over here to the right, and we'll scroll to the right, it says apply to objective 1. The provider must have completed, reviewed, or updated the 2021 security risk analysis anytime during program year 2021. EPs have until January 14, 2022 to submit their completed SRA. That's the final date you're able to submit your SRA. So you want to make sure that your SRA is going to be dated, though, in program year 2021, because your SRA, even though you can submit it the beginning of 2022, your SRA completion date and when you complete the SRA has to have been during calendar year 2021. And so when you go in here and you put in that completion date, say you actually completed it January of next year on the 13th, 2022, right? You're going to get this pop-up Excel box that says, hey, the SRA must be completed on or after the end of the PI reporting period, no later than December 31st. And so you want to make sure that as you're entering this information, you're eventually going to put all of this into EPIP. And so this Excel spreadsheet is kind of stopping you if you put in the wrong date. So if we put in the date of 10/31/2021, right, that's inside calendar year 2021, the Excel spreadsheet takes that because it is acceptable. Okay. Then the next thing is a requirement that occurred starting in stage 3. And so I'm sure most of you are aware, stage 3 has been required for program year 2019 through program year 2021. And one of these, this new requirement is that for immunization, the EP must be submitting data bidirectionally. And so you're going to put that date in of when did you start submitting data bidirectionally. If it was back in 2018, then you're good, because we know that you started submitting that data bidirectionally back in 2018, and that wouldn't have changed with the immunization registry. However, keep in mind, you had to have started exchanging that data by the end of 2021. So by December 31st, 2021, your system needed to be able to exchange data bidirectionally with the immunization registry. Another requirement that's an important date is the API enable date. And so this relates to Objective 5, Measure 1. And as you start to have more questions about this, or say you have a date that should be working, or you think it's a sufficient date, but the Excel spreadsheet's not taking it, there's always information out there. So first off, you can reach out to Access or Health Current if you have those questions, or if there's something you're coming across and you just can't understand a requirement of the program, definitely feel free to reach out to Access. Another way and tool that is useful is to go to the Access website, which we'll go to later on during this presentation, and you can look up. So if you have questions about this application programming interface enabled date, because maybe you're not sure what that is, well, there's a presentation out there solely on Objective 5 Measure 1, and so you can go and educate yourself on the API enabled date and what are the requirements specifically. Does your provider meet them? And so there's a lot of tools out there to help you, and if you're not sure where to go, you can always reach out to Access and ask them for where you need to go to find that information, and they can point you in the right direction. Okay, the next section is about general requirements. So EPs must meet the below minimum percentage standards for unique patients and encounters in CERT. And so this section for general requirement 1 kind of walks you through that. And as you can see, these blue cells is where you're going to be entering in that information. So say you saw 100 patients, and all those patients are kept in CERT. So you want to put 100 over 100, and then it's going to say requirement has been met. Now say that your CERT, you saw 100 patients, so that's in the denominator, but say only 20 of your patients are kept in CERT. The 80 other patients that you saw during the reporting period are not kept in CERT. And so when you put that 20 as a numerator, it's going to tell you that you do not meet this requirement. So it's kind of walking you through, because when you go into EPIP to enter in that information, it's going to stop you from moving forward in the process because you don't meet the requirements. And so this spreadsheet is kind of helping you walk through ahead of time to make sure you have all that documentation ready to go when you attest an EPIP. Same thing goes for general requirement 2, a minimum of 50% of total encounters. And so instead of unique patients, we're dealing with encounters. And so let's say that there's 150 encounters, all of them are kept in CERT. So therefore, both your requirements are 100%. Then you would come down here and do your reporting period. And so this information needs to be implemented because it's gonna flag you down the road if your API enabled date wasn't turned on by the end of the PI reporting period, if your SRA date's not sufficient, if you're not submitting data bidirectionally. There's a lot of things that's gonna help down the road. And so for this section, you're entering in your PI reporting period and your ECQM reporting period. And so let's just say it's gonna be the first 90 days of the year. Let's go enter in that information. It's going to tell you number of 90 days. Now, say that you're thinking 90 days is 3/25/2021, right? When you enter that in, there's this sentence over here that's in red, and it says you have not entered a 90-day MU reporting period. So it's telling you something's wrong. So if you see this red writing that pops up, make sure you go and read that, and that you're making sure that your provider still meets the requirements. Because we don't want you to go down the road and have done all this information just to find out in EPIP that you're not able to attest and meet the requirements. Same thing goes to CQM reporting period. Keep in mind that all EPs are required to attest to a 90-day CQM reporting period during calendar year 2021. Now, one thing that, and this is applicable to the PI reporting period and the ECQM reporting period, is both of those reporting periods, the end of the last date must fall on or before October 31st, 2021. So say you want to do 10/1/2021 to 12/29. Well, automatically this box is popping up saying, hey, this is invalid. The beginning of your 90-day reporting period needs to fall between January 1st and August 3rd, because you need to start on August 3rd to be able to have a full 90 days by October 31st, 2021. So let's retry and do a different date. Let's do August 3rd and see if that works. And so it's accepting that, and then your last day of your reporting period has to be 10/31/2021, and it shows that you have 90 days. Now, what if we did November 1st, 2021? It's not going to let you because it's not an appropriate end date. And so this comment is telling you the last day of your reporting period must be between March 31st and October 31st, 2021. Okay? So we're going to leave that as 10/31 because that's the appropriate last date that you can have your CQM reporting period. Then it's going to come down into your just general CERT reports that you're going to be submitting in EPIP. It kind of gives you some information. So it goes over the objectives that you have to meet. It also goes over the CQMs, how many do you have to meet, just a brief summary of what are the requirements that you're going to have to show that the provider met. So for CQMs, it's reporting on 6 of 47 measures to show how the EP competently and safely delivered appropriate clinical services to patients. Talks about the report that you're going to submit. It has the denomination numerators. Then just for stage 3, there's just a general section that just covers what you need to do. So there's 8 objectives for the stage 3 requirements. There is 20 different measures. So each objective can have a couple measures. There are some objectives that just have one measure. So you need to pay attention to that because you're going to have to meet each of those requirements. For clinical quality measures, you're going to have to attest to 6 CQM measures. It does tell you that there's 47 available CQMs, and then it goes over the requirements. So if you have some questions about clinical quality measures, again, there's a presentation out there that's on the Access website that you're able to go to. Okay, and again, in red, it's telling you in bold, in 2021, all EPs must at a minimum attest to objectives and measures using a 2015 edition. Okay, so that's kind of going over the entire general information tab. I'm going to zoom out so you can just see all of it from afar and just where those notes are. Just make sure you're paying attention to those. And if you have any questions, again, please feel free to raise your hand, put your question in the chat box, or ask to be unmuted, and we can talk through any questions or concerns that you have, or if you want me to dive in deeper and explain a specific objective or measure, I can absolutely do that. This third tab, which is the green tab, this is an example of what your tab is going to look like once you fill in all this information. And you'll see that this stage 3 examples for EPs, and we'll zoom in on this as well. This tab is going to look exactly like this orange tab at the bottom, which is stage 3 objectives. They're exactly the same except for the stage 3 objectives. This is the tab where you're going to enter in your information. You'll see it says John Smith because on the general information tab, I put John Smith in. So if I change that to Jane Smith, that information you inputted on this general information tab is going to be brought over to the stage 3 objective tab, which is where you're going to fill in the information for your provider. It pulls in the PI reporting period. If I had not put in the PI reporting period in on the general information tab, it would not be populated over on this tab. This is a tab where you're going to fill in all this information. We're going to walk through how to do that and just all the requirements. I'm going to go back to the stage 3 example tab just to show you. So there's kind of information at the top, and then right here, because this tab's been completed, it says congratulations, you have completed the 8 objectives. Now, right here for protecting patient health information, which is objective 1, if I change you meeting the security risk analysis to no, we'll scroll back up, and then it says right here, you have not completed all 8 objectives. So once you fill out the information, it's going to tell you, hey, either you meet the requirements or you don't. Now, please keep in mind that as you start to attest and everything, you're going to want to make sure you have the documentation to support what you're attesting to. Because down the road, whether it be prepay or potentially a post-pay audit, those documents are going to be requested. So whatever you put in, make sure your document shows that, because we're going to be comparing the documents you submit to what you're attesting. So make sure you have all your bases covered and you're collecting those documents as we go. Okay, so moving back to the stage 3 objectives tab, which is the tab that you're going to fill in once you're able to access this document. And so your provider name, your APN, and your reporting period is all going to pre-populate from the general information tab, which is why you want to fill out that general information tab first. Then it kind of walks you through some of the requirements, and it kind of gives you those instructions. So it says some objectives have more than one measure that must be met in order for the objective to be complete. Please fill in all yellow cells to complete the application. Rows 10 through 12 talks about what each of the colors mean. So it says the objectives and measures have been color-coded on stage 3 objectives reporting tab. And this light blue says stage 3 objectives and measures have been colored in light blue. The cells colored in yellow must be completed by the provider. And then over here in column L, you're going to see there's instructions that kind of walks you through what you need to do. So if you're confused at any point, there most likely is going to be some instructions on the right-hand side kind of walking you through what you need to do. Okay? It shows that you have not completed all 8 objectives because we haven't filled in any information yet. So you can see it has a 1 right here, which means objective 1 in column B. And then it says protecting patient health information. And right here in red, it's telling you must report on the measure by answering the question below. You must select yes or no in the yellow drop-down box. Please note that if no is selected, the EP will not meet meaningful use because there is no exclusions for objective 1. You must complete a security risk analysis. And so you want to read the question, and then right here, you're going to have a drop-down, yes or no. And to meet the requirements of this program, you have to complete a security risk analysis during calendar year 2021. Then there's another question. It says, will you be submitting the security risk analysis before or after October 31st, 2021? Note, the SRA must be completed no later than December 31st, 2021, and must be submitted by January 14th, 2022. So even though you're able to submit that SRA after December 31st, 2021, that does not mean you are allowed to update your SRA in 2022. Your SRA must be completed and dated during calendar year 2021. So let's say for this provider, we're going to submit it beforehand. Access does recommend that you go ahead and complete your security risk analysis and submit it by the attestation deadline, which is going to be October 31st, 2021. However, you do have the option of submitting it afterwards. Then coming down to the second measure, which is electronic prescribing, it walks you through what the objective is, what the measure is, and what the exclusions are. So each of these objective sections that walks you through all 8 objectives. It's going to go over this information. And then it's going to have these questions for you where you have a drop-down. And so we're going to say all patient records. Did you meet the measure exclusion? We're just going to say exclusion. Go ahead and claim that so we can move and not have to fill in as much information. Keep in mind, if you do select measure, that means you're going to have to fill in these cells. So if your numerator is 50 and your denominator is 50, 100% measure has been met. Now, say you only have 10 in the numerator, then it's going to tell you what that percentage is, and if you meet or do not meet the measure. So keep in mind that these numerator and denominator numbers are pulled from your CERT dashboard. Okay? We're going to go ahead and put that as exclusion. Right here for clinical decision support, it walks you through that. It tells you what the requirement is. You need to implement 5 CDS interventions related to 4 or more clinical quality measures at a relevant point in patient care for the entire PI reporting period. Absent 4 CQMs related to an EP scope of practice or patient population, the CDS interventions must be related to high priority health conditions. And one thing I want to point out here is that it walks you through what the requirements is for clinical decision support. And then it says, do you meet that measure? So say you say that you do, right? So you want to click yes, there's no exclusions for this measure. This section gives you the option to fill in all these CDS rules. So it says specify which CDS was enabled. So what did you have to implement? Say you have flag, high DPI. So you're kind of like walking through and putting all this information in. I want to point out that EPIP does not, when you're testing in the EPIP system, it does not specifically ask for what CDS rules were enabled. You're just in the CDS system saying, did you have 5 CDS rules implemented, and did they relate to 4 more CQMs? Or if that's not possible, did they relate to high priority health conditions for patients seen by that provider? And so the reason that we have this in this checklist is because if you are selected for a post-pay audit, then in that situation, we're going to be checking which 5 CDS rules were implemented and which of them relate to 4 or more CQMs. And so you want to make sure that you already have that documentation. So it's your choice whether to enter this information or not into this checklist, but we highly recommend that you do. In the case that you are selected for a post-pay audit down the road, you have this documentation. You know where to pull that information from, whereas down the road, if you didn't fill in this information, you may be scrambling for, like, what were those 5 CDS rules that were turned on? Which CQM clinical quality measures did they relate to? So this is just helping prepare you in the event of potentially being selected for a post-pay audit. Okay. Then moving down to measure 2 for this objective, this is for drug and drug allergy. We'll say that you met the measure. If you met the exclusion, you would put exclusion right there. Okay. And going back to clinical decision support, just to point one thing out. So no matter what, you have to have 5 CDS rules turned on. Now, when it comes to do those CDS rules relate to clinical quality measures, there's a lot of clinical quality measures. And what I would recommend is just going through, making sure those 5 CDS rules do relate to clinical quality measures. There's a tab at the bottom of the spreadsheet that says clinical quality measures. Go there. Look for how these can be connected, okay? Try to go ahead and connect those ahead of time. If they do not relate to clinical quality measures, you may potentially still meet the requirements of the program. However, then you're going to need to explain how the CDS interventions relate to high priority health conditions at your practice. So say, for example, there's only 2 clinical quality measures that relate to kids, and you're a pediatrician. You may not be able to relate to 4 more clinical quality measures because all you see is children. So you can potentially tie 2 of your CDS rules to high priority health conditions or to those clinical quality measures, and then you need to explain, hey, I am a pediatrician and I only see kids. Therefore, I could only relate these to 2 clinical quality measures. Something like that. You need to go ahead and put that explanation down because if you are selected for a post-pay audit, we will ask you that. Okay. Moving to Objective 4, computerized provider order entry. And for these, I'm going to go ahead and put the exclusion so we don't have to go entering in the numerator and denominator. Moving on to Objective 5. This has some more information you need to fill in because it's asking when was the API in your cert enabled, so you need to go ahead and put that date in. For program year 2019, the EPIP system only allows that time for you to enter in a date during calendar year 2019, but it has been fixed in EPIP. And so, for example, if you enabled your API back in August, so let's say 2018, you want to put in that exact date. You don't want to go putting in a date in 2021 if your API enabled date was back in 2018. You want to put the actual date your API was enabled. Make sure you have documentation to support that, because if we're asking that here, and we're asking on the EPIP system, that means down the road during prepayment or post-payment, we're going to ask for that documentation. And then it says, does your cert track both view, download, and transmit, and API, or only the VDT? And so for this, if you don't know the answer, reach out to your cert vendor and go ahead and ask them and put down that option. Your cert should be tracking VDT and API, but we just want to make sure, and so you need to go and get that documentation, and if your vendor responds in an email, make sure to save that email. Make sure to upload that into the EPIP system when you're testing. Do you meet the measure exclusion? We'll go ahead and we'll do measure for this one real quick, and we'll put, okay, 100% of your patients have access to their health records via API and VDT. Okay. For measure 2, we'll go ahead and put the exclusion down. Now, moving to objective 6, and this relates to objective 7. If the providers must attest to all 3 measures and must meet the thresholds for at least 2 measures to meet the objective. You do not have to meet the threshold, minimum threshold for all 3 measures. However, please keep in mind, if the EP meets the criteria for exclusion from 2 measures, they must meet the threshold for the 1 remaining measure. If they meet the criteria for exclusion from all 3 measures, they may be excluded from meeting this objective. So if you claim the exclusion for 2 of the measures, you have to either meet the minimum threshold for that 3rd measure or the exclusion for that 3rd measure. And so as you're entering this information, it's going to flag it for you. And so let's just go ahead and put down that you're taking the exclusion for all of these. And then we'll move on to objective 7, health information exchange. And so for this one, we'll enter in the information. This is the same type of thing. You need to attest to all 3 measures. However, you only need to meet the minimum threshold for 2. But if you take the exclusion for 1 measure, then you either need to meet the minimum thresholds for the other 2 or the exclusions for the other 2 measures. And so we'll put 50 as a 50. And then here, we'll also say you met the measure. Now, you still need to enter in this information down here for it to show you as passing, even though you could be failing it, because you already met the minimum threshold for the other 2 measures. So we'll put 1 over 50. Okay? Then moving on to public health and clinical data registry reporting, we'll just go ahead and claim that you met 2 of the measures. We met the measure here, and then we also met the measure here. Okay. We'll put the measure here as well, just to cover our bases. And then you can, once you've filled in everything, you can come back here and you can see it says you have not completed all the objectives. So where is there potentially a minimum threshold that has not been met? Or you said then you want to make sure you've filled in all the information. And so these yellow boxes, you may need to go and fill in the CDS was enabled, what was the name of it, things along those lines, to make sure that you're meeting all of these requirements. And also keep in mind, in column L, there is going to be information helping you along the way, just giving you bits of information regarding. So we're at public health, which is objective 8, and you can see there's a note over here for Arizona providers telling you potentially, so it says, Arizona providers, all Arizona EPs are not in a category of providers from which electronic case reporting data is collected. So it's already telling you for measure 3 electronic case reporting providers cannot submit data for that. The state of Arizona does not accept that currently. Okay. And you can also put not attested in certain areas potentially. because for objective 8, you only have to meet 2 of the measures. You don't have to meet all 5 measures. And so you need to still put in that information of did you meet it or did you just not attest to that specific item. And so we'll scroll back to the top. There must be a certain area here that's showing as failing potentially with the different formulas. And so you want to look through that. And again, if you're filling this out and you are having concerns with trying to pass the provider, you're not sure what's going on, definitely feel free to reach out to Arizona and ask them for help with this. We want to help you all as much as possible when attesting to these different measures to make sure that you're meeting the requirements and that things are going as smoothly as possible. And again, feel free to enter in any questions you have in the chat box. So for stage 3 objectives, once all the information is entered in, and if you're meeting all the measures, it is going to tell you whether you've completed it or not. And so on this example tab, it is going to turn green, and it's going to say, congratulations, you have completed the requirements. So if it's not turning green and you can't figure out why, again, reach out to Access, and the staff will be more than happy to help you to help make sure that you're meeting the requirements or point out where the provider may potentially not be meeting the requirements of the program. Moving on to clinical quality measures tab. Here, some of the same information is going to be pre-populated, and so I'll zoom in on this tab. You'll see on rows 5 through 8, it's going to bring in that information for what's the provider's name, what's their APN, and what's their reporting period. And so it's also going to have information at the top, kind of walking you through how do you fill this tab out, what are the requirements of the program for clinical quality measures, what do you need to do. So it points out there's 3 different requirements. EPs must report on all 6 CQMs in Program Year 2021. EPs must report on at least 1 outcome measure. If you're asking the question, what is an outcome measure? We have a presentation for clinical quality measures. It walks through what an outcome measure is. And so as you're going through this checklist, there is a wide variety of resources out there to help you if you're not understanding a specific requirement. It does walk through if no outcome measures. If there is no outcome measure, the EP must report on at least 1 high priority measure. And then moving down to C, if no high priority measure, the EP must report on relevant measures to the EP scope of practice. And so there, again, there's a presentation on this that walks you through that. Have you selected 6 ECQMs? And right here, it says no 6 have not been selected. This is a pre-populated statement. And so once you select your 6 CQMs, it's going to change to, hey, you did select 6 clinical quality measures. And so all 47 clinical quality measures are on this spreadsheet. And so again, these yellow boxes is for you to enter in, for the ones that you're going to be attesting to. So make sure in column B that you've selected the right CQM number, and then you put in the information. What's the numerator? What's the denominator? Okay? And we can go ahead and input some of this information so that it will come back as meeting the requirements. More than 6 selected. So earlier it said no 6 have not been selected. And now, because you put in those numerator and denominators, it's showing, hey, you selected 6. Make sure you're pulling the numerator and denominator from your clinical quality measures document, and also ensure that that CQM report is pulled directly from your cert. That is another requirement of the CQM section, is that your report that you pull your 6 CQMs from for attestation must show that was pulled from the cert. If the cert name or the logo is not on that report, screenshot the steps you took in your system to pull that report. Upload that to the EPIP system when you attest. Going over to the Resources tab, this is a table that walks you through each of the objectives, and it also has links to the different webinars. So for Objective 1, Protecting Patient Health Information, it walks through what is that measure, what is that requirement, is there a threshold, what type of documentation, and it's going to tell you. And so there's different types of documents. So it's saying that you need to submit an SRA report. Down for Objective 2, Electronic Prescribing, it says an EHR system report. So you're going to pull that report from your EHR, and you're going to pull that numerator and denominator from there. There's also all of these links that's going to take you to the Access website, and it gives you specific information on that objective. So if you're confused with a specific measure or objective, there's plenty of resources out there. So there's a retention webinar document, there's a retention tip sheet, there's also a webinar specifically on electronic prescribing, and so when you click on that link, it's going to bring up the presentation that was completed by Myers and Stauffer and Access. And so you'll see electronic prescribing, program year 2021, and it's going to walk you through what that is for program year 2021. We have these for every single recent program year. So if you are currently attesting to program year 2020, we have the webinars for this. We have a checklist for program year 2020. We're just specifically talking about program year 2021 right now. But again, if you have any questions, whether that be for program year 2019, program year 2020, or 2021, feel free to put those questions in the chat box or ask to be unmuted to ask any questions that you have. Going back to the checklist, so the resource tab, as I said, it's for every single objective. And so if you scroll all the way down, Objective 8, Public Health Reporting, and it has websites to go to that points you to different public health registries that are out there. And then it just talks specifically or generally about stage 3, and so there is a section for just in general what's out there for stage 3. What are the requirements? There's a brief summary of that, and then also there's additional hyperlinks taking you to different webinars that have been completed. There's a stage 3 webinar, which is just a general webinar on all the stage 3 requirements and what the provider needs to meet. There's also webinars on clinical quality measures at the very bottom, and it walks you through what type of report is needed, an EHR system report. And then also, what are those webinars out there? There's a clinical quality measure webinar, and so you can click on that, and it'll take you directly to program year 2021 clinical quality measure webinar. Okay. Going back to the checklist, we also have a compliance tab, and so it kind of, again, walks you through what 8 objectives there are, can the EP attest to it, what's the minimum threshold, are there exclusions for it? It'll tell you in this column, in column E, what exclusions are available for each objective. So for clinical decision support, it does show that there's an exclusion available, but for which measure? Because measure 1 for objective 3, there is no exclusion, but for measure 2, and if you go over to column F, it's going to point out which exclusion allows, which measure allows for an exclusion. Okay. There's information out here for Objective 8, Public Health Registry. It kind of points out what registries are out there. It talks about for Public Health Registry reporting that there is a cancer registry, and then that providers can potentially use depending on if they meet the requirements. If they have less than 100 cancer cases, they cannot use that Public Health Registry. So just keep that in mind. There is information on the Arizona Public Health Registry website, which I'll show you in a few minutes, just where that information is, what are the requirements for this specific Arizona registries. But again, keep in mind for public health, there are plenty of national registries out there, and our public health registry webinar does refer you to some of those websites that have a list of public health and clinical data registries that are at the national level. There's also a tab for exclusions, which kind of just specifically focuses on what exclusions are out there. And so, just like the other tables, it's going to tell you what the objective number is, what the objective name is, and it's going to walk you through what exclusions are out there, if any. For electronic prescribing, there's 2 different exclusions out there. One is for less than 100 permissible prescriptions, and the other is you do not have a pharmacy within 10 miles of your practice. And so if those exclusions you're not familiar with them, again, there's a webinar out there for electronic prescribing that goes into detail about these exclusions and how the provider is supposed to meet them. So just make sure if you attest to an exclusion that you have the documentation to back that. Now, I'm going to move away from the checklist unless someone has some additional questions. Again, if you have questions, please feel free to put them in the chat box or ask to be unmuted, and we can go back to that checklist. I don't see any questions in the chat box as of yet, so we'll move on to the Access website, and I'll kind of just walk you through how to use the website and what resources are out there. But again, most of these resources I'm about to point out to you are referenced in that checklist, and the hyperlinks take you straight to these webinars that I'm about to show you. And this website is on the first tab of the checklist. And so you can go in here, you can look for a lot of different resources that are available to you. And so when you come to the Access website, the link will take you to the Promoting Interoperability Program site, and there's quite a few things. So there's a webinar schedule list, so when you click on that, it talks about the different webinars, our previous webinars that we've completed. There's also webinars for documentation retention, and as you can see, there's Program Year 2021, Program Year 2020, and then Program Year 2018 as well. And so you can look back through these, say, okay, what type of documents? And so this documentation retention webinar is focused on what type of documents need to be kept over time in case there's a post-pay audit. So this is a very helpful resource. When you go in and click on that, it's going to take you straight to that webinar, to the presentation that we use. There's also webinars for patient volume. So there's individual patient volume versus aggregate patient volume. If you're attesting to a group proxy, that is out there as well. There's webinars for MU objectives and clinical quality measures. And so when you click on that, you're going to need to then go in and click on what program year you're attesting to, or because different program years, they might change slightly. So make sure whatever program year you're attesting to, that you're using the resources for that program year. If you run across an issue and you're not sure where all these resources are, you can't find it for a specific year, feel free to reach out to the Access and we can help point you in the right direction. So for any objectives for Program Year 2021, again, they're all here. There's a general webinar for MU Stage 3, then it goes down and goes through each of the 8 objectives and points those out. And then there's also one for clinical quality measures. You can see that there are 2 webinars for Objective 7. One is just general health information exchange. So it really just focuses on what documents are needed, what are the requirements for Objective 7, what exclusions are out there. And then there's a second webinar for Objective 7 that gives you just more information about health information exchange and in relation to transition of care, because this objective really affects the transition of care of patients as they're transferred from provider to provider. However, this first webinar, that's just the general overview of health information exchange, that is what focuses mainly on the promoting interoperability requirements and what type of documents are needed for that. So we'll close down the webinars for any objectives and CQNs. Then there's the tip sheet. And again, it's documented by each program year. So when you click on Program Year 2021, it's going to tell you, okay, Objective 1, protecting patient health information. If you go to Program Year 2020, you'll see the same thing, tip sheet for that. And so it kind of just points out some additional things that you may need. So if you have questions, definitely feel free to go there for that. And we'll close out the tip sheet and go to frequently asked questions. And for Program Year 2021, there's a lot more. It goes over each objective because sometimes there's not tip sheets for every objective, but there are webinars and FAQs, frequently asked questions. And so for here, you can see Objective 1, protecting patient health information, all the way down to Objective 8, public health and clinical data registry. So if you have questions, we may have already answered them in these FAQs. And so you can always go there and look at, okay, what questions are there, and then what's the answer. And I am going to pull up Stage 3 FAQ just for you to see an idea of what that looks like. So as you can see, for Program Year 2021 for Stage 3, you can see that we ask a question and then we're going to answer it, okay? And there's 7 pages of questions here. And so as you go down, you'll see there's a lot more questions, and so you can read through that. If you have a lot of questions about Stage 3, this may be a really great resource to go to first, to look at that, to see if it answers your questions that you may have. If it doesn't, again, feel free to reach out to Access and we can answer your questions. What type of documentation is required for each measure? And then the answer is a general overview of what type of documentation is required, and then also you can see this blue hyperlink, it takes you straight to the SRA webinar, because when it comes to your security risk analysis, there's a lot more requirements and details of that. And then again, at the bottom of each of these pages, it's going to take you to the webinar that relates to this FAQ. So if these FAQs, you're like, yeah, they're generally helping me, but I kind of want some more information on this, you can always come down and click on that hyperlink, and it takes you straight to the Access website, and you can go in and find your program year 2021 Objective 1 webinar and go there. Okay. If you have any questions on where to find any of this, or if you're looking for something specific that comes to your mind right now, definitely feel free to put that in the chat box, and I can bring up whatever resource might help you with whatever topic you're struggling with the most when it's testing for this program. So that's it for the Access website that I wanted to show you today. Oh, there was one more thing. I did want to show you the calendar. So there is a Access calendar on their website that I've just pulled up, and so it kind of just generally shows you for the entire month what webinars are out there. A lot of them are just in general relate to Medicaid and Medicare programs. However, when it comes to the webinars that we're conducting, we are helping Access and doing one webinar a month. And so Access and Health Current are working together to provide that to y'all. And so if you're wondering when that next webinar is coming up in May, you can come here to their Access calendar, and Health Current also has it on their website, and you can come in and look at that and say, okay, when is the May PI program doing another webinar? And most of the webinars do start, it'll say PI program : and so you'll see which ones are related to the PI program. And you can see on May 20th, there's another one, and it says open forum. And so for y'all to know is the majority of the webinars finishing out the rest of this program are going to be open forum to help make sure we answer any questions that you may have while at testing. Now, each open forum is going to be focused on a specific measure to kind of start to talk about what are the concerns and, you know, what are the big requirements that some providers may be missing. So the webinar coming up May 20th is going to be focused on protecting patient health information, and then also, which is Objective 1, and then also the Public Health and Clinical Data Registry reporting requirements, which is Objective 8. But again, if you have questions related to other requirements of the program, definitely feel free to bring those to that webinar and ask them there, or ask them on this call before this webinar ends. There's also a link that takes you to where to register, so make sure you're registering for those webinars so you can get those reminders and any information that's sent out. The other website that I wanted to show you is the Arizona Department of Health Services. And this website kind of gives you just a general idea of what registries are out there in the state of Arizona. So as you can see, it does talk about the Arizona State Immunization Information System, and then also electronic lab reporting, which again, as I mentioned very briefly earlier on during this webinar, that providers are not able to submit data to the electronic lab reporting. There's also syndromic surveillance, and then the cancer registry. And to submit data to the cancer registry, the requirement is that you need to see more than 100 cancer patients, and then you also need to have a specific specialty. So if you do have questions about that and whether you would meet that for a registry, definitely feel free to reach out to the Arizona Department of Health Services or even Access, and we can help walk through to make sure you meet Objective 8 and that you're submitting data to a public health registry. And again, there's more information on all these. You can click on each of these links, and it kind of takes you to that registry, kind of walks you through. It even gives you contact information for who to reach out and ask any questions. And that is all that I had to show y'all and kind of walk through. If you do have any questions, I'm happy to stay on this call longer and show y'all any additional resources or even walk through what a specific requirement is for example, say Objective 1. Any information that y'all want, definitely feel free to put any questions in the chat box or even request to be unmuted, and I can answer those questions for you. Christine, have you received any questions, or Connie?
Hi, no, we haven't, Priscilla, yet. Again, that chat box is open. If you would like to come off mute, you're welcome to do so. If you have a question, you just have to simply unmute yourself. This was a great presentation today, very, very informative. Just a reminder for all of you who have registered and participated in today's open forum, you will receive a copy of this, I believe. Is that correct, Priscilla? We'll be able to send this out?
Yes, we will be sending it out within the next business days.
Okay, fantastic. And we did record today's call, and we will be posting that along with the presentation to the Access and Health Current websites. We're going to leave the lines open. Again, you can unmute yourself or raise your hand or use the chat box. This is a great opportunity to get your questions answered in this open forum today. So we'll pause there and see if there are any that come through.
And just one more thing that I did not point out earlier, there is a section for reference guides on the Access website, and it kind of walks you through screenshots of what the EPIP system looks like when attesting to different measures. And so that is another just resource out there. If you haven't attested in the EPIP system for a while and you're waiting to attest for Program Year 2021, even though you're not able to attest for Program Year 2021 in the EPIP system, keep in mind that you can go in there and look at any. There's a lot of helpful information in those guides. As well as, I'm sure you're all aware, but attestations for Program Year 2020 is currently open, and then Program Year 2021 will be opening soon, and the deadline to attest to either one of those programs is October 31st, 2021. We do recommend you attesting as soon as possible because that allows the prepayment team to reach back out to you if your documentation is not sufficient, and then you have additional time to submit sufficient documents to Access. So the sooner you attest, the better for you, and it gives you more time to submit those documents because when that deadline closes, we will be requesting certain documents and you won't have as much time to gather everything. So the sooner you attest, the better.
Wonderful. Thank you again, Priscilla. We are, again, holding any chat questions. Please place them in the chat box, or again, you're welcome to raise your hand or come off mute. This is, again, a great opportunity to ask questions directly to the folks at Myers and Stofers and have your important questions answered. So we'll pause there for just another minute to see if there are any additional thoughts, comments, questions coming through before we conclude today's webinar. Priscilla, you've done such a great job. You've answered all their questions. So with that, we're not seeing anyone posing any questions in the chat, any requests to come off mute. So with that, we will conclude today's open forum webinar. Thank you so much, Priscilla and Access, for the presentation today. Thank you for all participating and enjoy the rest of your day. Take care.